whenever you're getting the therapeutic doses of the drugs that's already in the animals, and that makes if you have any infection, it makes the bacteria that are in you become more resistant. And remember, what is becoming resistant is the bacteria, not you, the person. Yeah, so you end up being infected by the bacteria that are resistant to antimicrobials. The other thing is that probably they were treating some infection in these animals, and then it wasn't well treated, so the bacteria in those animals became resistant. And then these bacteria now, when you consume the product, end up infecting you as well. So they infect you when they're already drug resistant. So those are two ways about it. So back to your question, still about One Health. I think as a nation, we have put together measures to try and push the collaborative effort through the One Health approach. So we have, I think since 2017, we've had what we call the NASIC, National Antimicrobial Stewardship Interagency Committee. So this committee is basically tries to bring together the different ministries, both the animal health and the human health, as well as the environment and other aspects, trade and all that. So there are different ministries involved in this, and there's representation from the different ministries. So NASIC has a steering committee that's mostly led by the senior teams from these different committees. Then we have the technical working groups, and we have a secretariat. So the secretariat is made up of people from both the animal health and human health. And the reason for this is that the secretariat is the one that ensures that the policies that are developed at NASIC are implemented in both the animal and human health. And of course, like you mentioned earlier, there has been engagement with different partners who work together to ensure that they are helping to push this agenda to the lowest level. So after NASIC, the structure of AMR governance is that we have NASIC as a national level, and then this is supposed to be cascaded to the counties where we have CASICs, and CASICs are county antimicrobial stewardship interagency committees. So these are supposed to replicate what is happening at the national level to the county level. So if you go down to the counties and they have active, for the counties that have active CASICs, then they are able to bring together the different stakeholders from both animal health and human health to be able to discuss and to develop protocols and policies around tackling AMR. And I think also at the national level we have developed different documents, including AMS guidelines for the hospitals, strategies on consumption and use of antimicrobials, and most of the time these are still replicated in the animal sector. So there is a lot of effort. I know we are not yet scratching the surface too much, but there's a lot of effort being put towards this. And I think with time, we will see it bearing fruits. Because like for the animal health, they go to the level of, supporting like the animal labs, the microbiology labs in the animals, and all the way to the farmers. So they are able to take samples from the animals in the farms, bring these to the lab and they are processed, and that helps them to develop guidelines on how to manage antibiotics in animals. So there is effort that's happening, and probably for the 6 years, as we go out into the community to become interns, probably you learn in these county hospitals and find that there are such processes happening. So again, for us, Marriane and I are here to throw this agenda to you and help you to become AMS champions wherever you are. Right? Yeah.
I don't really think that there's any more you can add on that. Perfectly elaborated. Okay. So moving on to our last objective. Dr. Marriane, are public and private partnerships the only way to spur development of badly needed new antibiotics, or are there other ways to promote innovation financially?
That's an interesting question. Now that trickles down to finances, and I think for us who are in the lab, that's usually our last thought, but it's a very important one because that's what drives our research. So yes, they call them PPPs. Oh,